All right, I just want to get through to mostly families of schizophrenics, make them aware of essential things they need to know about schizophrenia if you want to be able to help your brother, sister, son or daughter, or whatever the case may be. Number one, you cannot just ignore the voices. Trust me, it's not that simple. Voices are extremely real to the patient. They cannot just be dismissed. They can't be ignored. They are... Look, if you could just ignore, dismiss the voices, trust me, schizophrenia would not be much of a condition whatsoever. It would be easily dismissed and easy to live with. Voices are real, extremely real to the patient, and it's lacking upstairs if you think you can just tell them to just ignore them, because that's the last thing we like to hear. Secondly, I want to tell you, be aware that medication, antipsychotic medication, is not a silver bullet. It will not solve the problem like that. It's a lot. It's going to take a much. For me, it took a holistic approach. Medication, it helped relieve some level of anxiety, but it never relieved me of the paranoia. It never relieved me of my delusional states. And for me, because my schizophrenia was very spiritual in nature, as it is for a lot of people, what actually helped me, in truth, was the practice of faith and spirituality. It truly helped me a lot, because as I said, if you're dealing with spiritual paranoia, disturbed by the devil and all that sort of crap, trust me, the practice of faith helps quite a lot. It has me, definitely. Thirdly, I'd like to just say, look, as regards to medication, be aware that it causes debilitating side effects. This is the reason schizophrenics do not appreciate necessarily being on these medications. They do cause debilitating side effects. They can leave you very sluggish, lethargic, lacking motivation, and just feeling downright flat. Like, that is not a nice way to be, so you should not be getting on their case. And this probably leads me into my next one. Be aware that when you have schizophrenia, it is, for a lot of people, it's extremely difficult to work and function in the workplace, whether that's college or whatever the case might be. Do not be getting on their case in relation to that. Allow them space and time for recovery, because trust me, schizophrenia is extremely difficult to put up with. How could you possibly, for a lot of people, schizophrenia, when they're in a psychotic state, it's a bit like having a nightmare while awake. How on earth are you supposed to function in the workplace when you're going through that experience? And lastly, I want to say, just be aware, don't bother challenging your son or daughter or whoever it is who has this illness about their delusions. Be aware, delusions are fixed, rigid beliefs they're going to adhere to no matter what sense of reason you try and impose upon them. The reason I tell you is don't get on their case in relation to that. It only causes rows. Give them time and space to recover. They will recover, but just give them time and space and be patient.